Welcome to Virtue Podcast, powered by Azkka Pharmaceuticals, India's first company to bring evidence-based flat pricing in medicine. Virtue Podcast brings in renowned healthcare experts as we explore the path to healthier living, where science meets virtuosity. Tune in to YouTube, Instagram, Facebook, and Spotify as we welcome our virtuous guest. Don't forget to subscribe, hit the bell icon for the latest updates, and leave your comments.
This is first time in Azkka Virtue Podcast. We are trying to bring in some fun element where we'll discover the doctor behind the white coat personally, honestly, and in a fun way, answering it rapidly and with a lot of fire, as we call it the rapid fire round. Are you ready for it?
Absolutely.
Okay, here we go.
First of all, I must congratulate you and thanks you for raising this untouched topic, and which is very important for our educating people is equally important. Rather, clearing their doubts is equally important than educating them about science.
Doctor believes one powerful thing: informed patients heal better than scared patients. And today he is here to clear some of the biggest health myths patients still believe in. Everybody is very curious how to differentiate between facts and the myths. And I'm sure that so many patients must be coming to you, and your clinical experience, we would like to bring it to our viewers and get things sorted. So personally, I am very curious about this conversation. So welcome, sir. Hello, everyone, and welcome to another insightful episode of Azkka Virtue Podcast, where we bring science, clinical wisdom, and real-world healthcare conversations together for doctors, patients, and caregivers alike. Today's healthcare world is not just shaped by doctors and hospitals. It is shaped by WhatsApp forwards, Instagram reels, Google searches, and family advice. From diabetes medicine damaging kidneys, to blood pressure being normal for age, to fear of lifelong medicines, these beliefs are affecting real treatment decisions and sometimes costing lives. Today's episode is about separating medical truth from viral myths so patients can make safer, smarter, science-backed decisions. And today, for this interesting conversation, we have with us Dr. Abhay Poekar from Chhatrapati Sambhajinagar, Maharashtra, a respected clinician known for his patient-centric approach and strong focus on evidence-based treatment. Sir has helped thousands of patients manage chronic conditions like diabetes, blood pressure, and heart risk, not just with medicines, but with education, clarity, and practical lifestyle guidance. Doctor believes one powerful thing: informed patients heal better than scared patients. And today he is here to clear some of the biggest health myths patients still believe in. Sir, it is such a pleasure to have you for this conversation. And who better than you, having such a long clinical experience in the city of Chhatrapati Sambhajinagar. I'm sure this is a very interesting topic. Everybody is very curious how to differentiate between facts and the myths. And I'm sure that so many patients must be coming to you, and your clinical experience, we would like to bring it to our viewers and get things sorted for all of us. So personally, I am very curious about this conversation. So welcome, sir.
Thank you. And first of all, I must congratulate you and thanks you for raising this untouched topic, and which is very important for our educating people is equally important. Rather, clearing their doubts is equally important than educating them about science.
Right.
So we must teach them about what is the correct thing and what is false.
Right.
And this is a good platform, and you have raised this very wonderfully.
Thank you, sir. So, sir, I'll dive right into the first question. Many diabetes patients fear medicines more than the disease itself. सोशल मीडिया पे सर हमें इतना सुनने को मिल रहा है कि फैमिली में भी डिस्कशन स्टार्ट हो जाता है कि डायबिटीज़ की दवाई खाओगे तो किडनी पे बहुत डैमेज होता है. दिस फियर समटाइम्स मेक पेशेंट स्टॉप मेडिसिन्स which can be even more dangerous. So, sir, can you please clear this confusion? Do diabetes medicines really damage kidneys, or does uncontrolled diabetes will cause more damage to the kidneys?
Very interesting and very nice question, because diabetes diagnosis itself is a huge burden, or probably a huge trauma,
True.
mental trauma to the person, to the family. So it is very natural on their part not to accept first of the thing. So they are very reluctant in accepting that I have a diabetes, unless they are very well motivated, educated, they have a strong family history. So they will accept it. Otherwise, most of our people do not accept that. That is very natural, because on their part, we must understand. Simultaneously, we have to understand that diabetes is becoming at a younger age,
Right.
because that World Health Organization has clearly said that 10 to 15 years younger generation will get diabetes. If you see, our elder used to get diabetes at 60s, 50s. Now it is at 35, 30s.
So
Now it is said that even at 20 and 25, for the next generation, they are going to have some impact of diabetes. And it has multiple issues. So we will discuss it at some time. But obesity is one of them. But so accepting diabetes is their first thing. Second thing, once they have diagnosed ki I have diabetes, they have accepted. Then accepting treatment is another challenge for whole of this society. So because there are some myths, there are some miscommunications. Because as you have asked correctly, ki whether diabetes medicine damages kidney or something else is there. Because they have known some patients, उनको कुछ पेशेंट्स के बारे में मालूम रहता है जिनका किडनी खराब हुआ रहता है, लेकिन इट इज बिकॉज दे हैव डायग्नोज लेट with diabetes with kidney disease. Because diabetes is a silent disorder. It is estimated that 70+% of the patients will not get diabetes diagnosis. It is only incidental diagnosis. कोई कैटरेक्ट किया जाता है, किसी को ट्रॉमा होता है, किसी को स्क्रीनिंग टेस्ट में होता है, किसी को LIC पॉलिसी में होता है. Most of the patients, after getting the diagnosis, because that is many times it is late. So at some time, many of them have some sort of underlying kidney disease. Some are passing albumin in their urine, so we call it as a microalbuminuria. So some sort of kidney damage or some kidney insult has already occurred in few of the patients. And on the top, if they take some of the medicines, and actually what happens, the medicines like painkiller, the medicines which are taken over the counter are taken so naturally, so easy, commonly, the damage caused by them is never understood. And the other medicines which are taken simultaneously, very important precious medicines like diabetes which are taken, they are blamed for it. So it is never diabetes medicine. It is never diabetes medicine. It is never diabetes medicine. Because I am repeating is, unless patient has already had some kidney disease and which was not diagnosed, which was not evaluated, and was given some other medicine along with diabetes medicine, so it may have some sort of clinical impact on his kidney disease. So per se, diabetes medicine do not cause. On the contrary, diabetes medicines prevent kidney damage. Because if you see all the meta-analysis and all the trials, they have showed if you reduce your HbA1c, the 3 months average blood sugar, or even if you reduce your blood sugars, your chance of getting chronic kidney disease or kidney disease is reduced by 20%. So it is never diabetes medicine. On the contrary, diabetes medicines are going to prevent your kidneys.
Okay.
So it is on the reverse rather.
So I think, sir, this is such a nice way that you have explained. You have gone absolutely into the root कि जहाँ से एक्चुअली एक फॉल्स नैरेटिव स्टार्ट होने की पॉसिबिलिटी है, वेयर डायबिटीज एज अ कंडीशन इटसेल्फ causes kidney damage, and people try to correlate with the medicines. So I think that is actually a big myth that you have busted right now. So it is only related to diabetes medicine, or so what is your take on insulin?
Yeah, absolutely right and wonderful question. Because what happens if you have a chronic kidney disease or kidney damage has gone to some other stage, like other or advanced stage, where few of the diabetes medicines are absolutely not given. Because they have some other side effects, like they cause less blood sugar, hypoglycemia जिसे कहते हैं हम, यानी डेंजरस लेवल पर ब्लड शुगर कम हो जाती है. बिकॉज किडनीज डू नॉट एक्सक्रीट मेडिसिन्स, सो द मेडिसिन अकुमुलेट. और फिर ये कुछ जो ओरल हाइपोग्लाइसेमिक्स है और टैबलेट्स बोलते हैं अपन डायबिटीज की, इट कॉजेस मोर ब्लड शुगर, लो ब्लड शुगर, हाइपोग्लाइसेमिया. एट दैट टाइम द सेफेस्ट ऑप्शन it becomes insulin.
Right.
So few of the medicines which were usually given
Hmm.
initially for diabetes management now cannot be given. And at this time, insulin becomes the gold standard.
Right.
Rather, insulin becomes the best medicine for patients who have got chronic liver disease, chronic kidney disease, chronic heart disease. So patients who have got some chronic diseases at that time, better than medicines, insulin becomes the first choice.
Right. So I think that actually summarizes that how important it is to understand from the right person. So I think getting into the roots that coming from you, I'm sure will make a lot more sense to the viewers at large, because studies have also shown that nearly 40% of kidney failure cases happen because of diabetes remains uncontrolled for years. So taking medication is really important to control diabetes and ultimately damage to the kidneys, and it's not the other way around. uh, so there is also a strong emotional fear attached to diagnosis. As you mentioned, वो acceptance आना सबसे पहले बहुत ज़रूरी है. Many patient immediately asks that will I have to take medicines for life. ये सबसे बड़ा एक fear जो commonly हमें नज़र आता है कि अब मेरी ज़िंदगी डिपेंडेंट हो जाएगी मेडिसिन्स पे, पूरा लाइफ मुझे लेना पड़ेगा. So is diabetes medicine always lifelong, or can lifestyle changes reduce or stop medicines in few or some of the cases?
Absolutely wonderful questions. There are 2 to 3 subsets to your question.
Mhm.
First is whether I need to take lifelong medicines. So answer to that, for long life, you have to take lifelong medicines for most of the patients.
Right.
But patients who are young, who have new diagnosed diabetes, who are obese, and who are willing to give a good time to lifestyle modification are the candidates who can remain in remission phase of diabetes.
Okay.
Diabetes reversal word has not come in science. It is diabetes remission. Remission is where you can have diabetes control without medicines or with list of the medicines, minimum medicines. That is diabetes remission. And remission का मतलब ये रहता है कभी भी वो आगे आके फिर से बढ़ सकता है. So there is a chance of relapse. So that is a word remission. So reversal is a myth at present. Science is not accepting reversal word,
Right.
but remission is usually possible. A patient who is usually motivated for lifestyle modification and good time given to the exercise, particularly aerobic plus resistance exercise, a huge balance about diet, sleep, and career will definitely reduce the incidence of having increased number of tablets. So tablets की संख्या भी कम होगी, कभी कभी without tablets भी अच्छा खासा diabetes manage हो सकता है. So it is always a lifestyle first.
Correct.
All the guidelines, whichever are the international, are always focused. Lifestyle modification is a topmost.
Right.
Rather, it has preferred over the oral drugs. Few of the oral drugs are inferior to the lifestyle modifications.
Wow. Okay.
The HbA1c reduction is assumed to be 1%, which is not possible with few of the oral medications of diabetes. So such a wonderful effect of lifestyle modification is there on diabetes remission. So lifestyle is always the first thing.
Right.
And then comes the medicine. And we as a clinician, we should be, our focus should start always with lifestyle modifications. That should be, there are few clinicians who write first prescription, first they do not write medicine. Exercise they write as a first medicine, drug list में. और बाद में वो लिखते हैं diet, and third thing they write medicine. So that is the moral of the story.
Right.
So like you have to give utmost importance to lifestyle modification as well.
Right. Sir, I also would like to add that lifestyle modification cannot be just a sport of 1 month, 2 month. वो नहीं कि जैसे न्यू ईयर स्टार्ट होता है जिम भर जाता है कि अभी मुझे लाइफस्टाइल मॉडिफाई करना है, बट फिर 3rd मंथ अगर जाके देखे तो वही जिम खाली होता है. So it has to be a part of your life, and that is why it is called lifestyle. So that has to continue and it has to be very consistent.
Absolutely
Right. And I think that is also one of the very important factors, as you said, which can help to reduce the pill load and also to ensure that remission, which is a new term for viewers, I'm sure. So sir, patients also sometimes worry after reading internet articles on statins, which is cholesterol lowering drugs like atorvastatin or a rosuvastatin, that it may cause internal bleeding or severe, hidden side effects. Not only for statins, even for blood thinners, antiplatelets. So, can you throw some light on this? That what is the myth around it?
First, I will go to your first part, like lifestyle modification inconsistency, because the lifestyle modification becomes monotonous for the most of our patients. So their diet, their exercise, their sleep, they feel it is like monotonous. So many of time that monotonicity they want to break, and that's why that lifestyle modification benefit is not passed for many more months, and at that time the role of drugs comes. So why we require drugs? Because we are not very much consistent about our lifestyle modification. So if you remain consistent, whatever consistency you remain, maybe 20-30 minutes a day, but is a must. So if you remain at that time, then your health will remain constant. That is first part.
Right.
And then the second important thing about statin. Statin is the one of the most important pillar of the treatment of the patients who have undergone coronary angioplasty, patients who are having diabetes with dyslipidemia, patients who have got multiple coronary atherosclerotic risk factors, not only coronary, it could be cerebrovascular, it could be pedal. So patients who have got atherosclerotic cardiovascular risk factors, they are the patients who have the highest risk of developing myocardial infarction, stroke, or gangrene, or some sort of vascular damage.
Right.
So for this patient, statin is considered as the gold standard, because it is the medicine which has prevented almost 50% of the cardiac issues. So it is the most important thing. Second thing about the myths or the misconceptions, because statin cause muscle issues, which is less than 1%. Statin cause some liver injuries, which is very much reversible. So neither of the problem, whether it is muscle or liver, it is never permanent. And that muscle injury, when it is not controlled or it is not understood, which is not estimated, can lead to kidney disease, which never happens, because patients immediately comes to you कि I have developed पैरों में दर्द हो रहा है, पिंडरों में मेरे को दर्द हो रहा है. So we can recognize कि now I have just started statin and probably that has caused. So it passes over the time, or rather we reduce the dose or we make it alternate day. So depending on his values of cholesterol, LDL cholesterol, and overall his risk of having vascular disease, we always calculate the dose of rosuvastatin, atorvastatin, whatever statin it is. So it is not possible if we ignore that. If we ignore that, it is possible. But if you come to our come to the expert with some sorts of issues after starting statin, that is totally reversible.
Right.
So statin is a wonderful drug. Probably most wonderful amongst all the drugs which are there to prevent coronary thing. Second, about antiplatelet drugs. So many patients after getting angioplasty done, they have a dual antiplatelet drugs. They require 2 drugs at least per year. But the patient who has a high risk of bleeding, elderly patient has got chronic kidney disease patient who have got gastric ulcers. So these are the patients who are at high risk of having high risk of bleeding. At this time, the clinician cardiologist always judge. He may cut short the duration to 3 months. And even if he has some bleeding issues, the doses of antiplatelet can be reduced. So not all patients develop bleeding tendency, and some mucosal or some short some minor bleeding can be managed with stopping of the drugs for few days. So it is never a major bleeding, because they are antiplatelet, they are not blood thinner per se.
Right. So these are basically gold standard drugs which has been used since years now, I would say decades. And if in and around anything around it is always manageable.
Right.
So if I come to blood pressure numbers, that confuse many patients. Some people still believe that 150/90 is normal for age. ऐसे ही सर कभी कहीं हम गार्डन में गए, जॉगिंग कर रहे, कोई ऐसी कैजुअल डिस्कशन हुआ, इफ somebody throws some number के 150/90 randomly, तो सामने वाला भी कैजुअली बोल देगा अरे इसमें तो कुछ नहीं होता है. So and they feel medicines started at 140/90 are unnecessary or very aggressive treatment done by the doctor. So, sir, what is considered normal blood pressure today, and why do doctors actually start treatment at 140 by 90 in many patients?
There are 2 to 3 answers to your questions, 2 to 3 subsets rather. First thing, it was initially or it was previously considered 140/90, 150/90. After the age of 75, 150/90 was considered normal. Now, for the age 50 to 70, the criteria is 130/80. Should never be more than 140/90.
Okay.
So 150/90 is out of question.
Hmm.
Unless patient is very frail, patient is more than 80 years age, patient has got some comorbidities. So at that time, 150/90 is acceptable. But it is exceptional. So for most of our patients, the guidelines are very rigid because it is found that even 10 millimeters reduction of systolic blood pressure reduces your risk of stroke, congestive heart failure, myocardial infarction, atrial fibrillation, every cardio cerebrovascular events by huge percentage.
Wow.
Mostly about 20 to 30%.
Wow.
So such type of advantage if we are getting by reducing systolic blood pressure, so that advantage is passed by these guidelines. So it is considered to be very safe to treat the patients of high blood pressure.
Right.
Even the guidelines are now saying 135 to 85 to 89 as a stage 1 hypertension. So such a sort of staging is done. So second very important thing, a patient who has got 140/90 blood pressure, if he has all sorts of good lifestyle modification, higher like fruit intake, good fruit intake, low calorie intake, non-veg intake should be less, like no alcohol, no smoking, then aerobic exercise. Some of this reduces your blood pressure by almost 20 millimeters.
Wow.
So such a sort of, it is more than any other medicine.
Right.
So summing of this, all sum is very difficult. But if patient is really desire and wants to do this, then definitely without medicine, patient can remain without medicine lifelong.
Wow.
For hypertension if he continues to follow with physician.
Right.
Additionally, because once it is normal, if he's not going to the clinic, then that is another issue. So he should be having good follow-up. Hypertension is a one condition where patients usually remain normal without medicines if he follows a good lifestyle.
Wow. So, sir, actually, this clarifies a lot of things because these numbers have always been very confusing. And I think you have really clarified for everyone that, at what stage it is acceptable and what is absolutely not, and what is required. I mean, the lifestyle changes, which is our controllable, I would say, which is always in our hands. So this also makes me curious to ask, which we hear very commonly. Sometimes we confuse, pain caused due to cardiac issues with very common something कि नहीं ये तो सिर्फ थोड़ा fatigue हो गया है, थोड़ा gas हो गया है, या थोड़ी weakness है, and ultimately the important time just goes away. When should a symptom be considered serious enough that patient must seek immediate medical attention?
I think answer to this question lies in how much risk you have of having these issues. The risk depends on your age, your family history, diabetes, hypertension, your lipids, your obese, physical activity, smoking, tobacco in our part. So all these are the risk factors for having coronary or cerebrovascular artery disease. Maybe like he's younger than 20 years and has got some sort of localized pain somewhere, and which has aggravated after activity, is unlikely to be cardiac. But a patient who is middle-aged, who is obese, and who has some discomfort which is not able to explain, he or she, and has got some retrosternal discomfort, which that fellow attributes to his gastroesophageal reflux, even epigastric pain, and which is bothering that person, and which he feels is not good or which is not natural, and which is not relieved with simple PPIs,
Fantastic.
which he should take immediately if he feels, and if it's not responding, he should immediately go to the clinician.
Right.
So risk factors is probably the cornerstone, and otherwise also, irrespective of that, if you have something which is said above umbilicus, if you have any discomfort, it is always better to clarify it, because the symptoms are very atypical most of the time. So typical chest pain may not be present always, and it is very easy to get sort of local physician's advice as early as possible.
So true. And I think it is most important part here would also be don't be under any false impression कि मुझे नहीं हो सकता है. So I think that is the biggest myth that everybody lives in, and it is very important that any such symptom needs to be at least we need to make sure that we seek medical attention and get it. ज़्यादा से ज़्यादा क्या ही होगा कि we are visiting, getting our basic screening done and coming back home. But I think it is something, it is life saving, I would say.
Absolutely.
Right. So today in the era of social media, Google, pharmacy advice, which all these things are influencing treatment decisions. Many patients take medicine without consulting doctors. Sometimes shift from allopathy to some alternate medicines or therapy, just looking at by some reels or somebody randomly who is not qualified as advised, or just Googling or chat GPT or whatever. So can you explain to our viewers what are the risks of self-medication, especially for chronic diseases like high blood pressure, diabetes, heart disease, or even infections for that matter?
Self-medications are many times harmful because they are taken without an expert advice. So before prescribing any medicines to any of our patients, we take whole of his information, his or her, regarding what is duration of disease, what risk factors he has about that disease and other diseases, then what family history he has, what occupation, what type of social history, what type of habits he is having. So at the time of prescription, it is thoroughly understood, calculated, and then given a treatment. So it is an expert who is giving you a treatment, and which is not based only on some parameter or of one single symptom. It is never that. That is called as consultation.
Right.
And when somebody is taking self-medication, then it becomes like very difficult because nothing is calculated at that time. It is universal for everyone.
Right.
It is not and it fits to all. So it has some its own issues regarding that. So having an expert advice is important thing. And shifting from this pathy to this pathy, I feel we should have some sort of what we can say. You should continue with whatever is evidence based first out.
Right.
And you can always have some sort of good benefits like Ayurveda, some Ayurvedic yoga, pranayam. They are from Ayurveda.
Right.
So we should complement to our medicines, because these are the medicines which are since decades together,
Right.
and which has a huge benefits. So they should be complementary, but they should not replace any of the medications, because we are often get thyroid related issues. Patients do have these medicines are stopped and some other medicines are taken. Actually thyroid is one disorder where the hormone is actually जो tablet है वो बिल्कुल वैसी की वैसी है जैसे कि तुम्हारे शरीर में बनती है.
Right.
सिर्फ वो सिंथेटिक बनी है क्योंकि वो शरीर में जाने के लिए जो भी उसमें केमिकल ये चाहिए चेंजेस है उतना ही हुआ है. So it is as good as you are getting a hormone. So it is almost same. So उसमें भी लोग usually take self medications for their own. So it is म्हणजे it is not advisable.
Yeah, it can become life threatening.
Absolutely. Because you are not having objective कुछ भी नहीं उसमें. You are feeling well, that is the only thing. It is subjective. You are not checking your blood sugars. You are not checking your blood pressure. You are not checking your lipids. You are not checking anything. But you are feeling well because you have been burdened with this information. This is bad. So I am not on bad things now. So that has that euphoria probably makes them happy. And वो अभी मुझे ठीक लग रहा है सब दवाई बंद करने के बाद. लेकिन we never know because we know this instance is so long कि उसने 8 दिन ही गोली नहीं खाई तो उसको पैरालिसिस हो गया, उसको हार्ट अटैक आ गया. So these things are very common. And even under मुझे टेका लेना भी है तो कुछ दिन छोड़ के लेना है, आधी लेना है, उसको बंद से करना है, ये सारी चीजें भी होते हैं. वो सब सेल्फ ट्रीटमेंट है, वो सेल्फ मेडिकेशन सेल्फ ट्रीटमेंट का पार्ट है वो.
And this can be so dangerous.
Absolutely.
So sir, today as medicine is advancing rapidly, but myths, spread even faster through social media and word of mouth advice. Also, in your clinical experience, you must be getting so many such cases. So we have tried to touch on few of the points here of diabetes or statins, but I'm sure in your clinical practice there will be so many more others. If you can share some of it, and you feel that for our viewers, okay, this is a big no and needs to be taken care of.
Very important thing which we usually say, because we see many respiratory patients. So patients who are having asthma or chronic obstructive airway disease, we prescribe them inhalers, rotahilar inhalers or what. So these are the type of medicines which directly go to your lungs. And at that time many patients do have hurdle about taking those inhalers, rotahilars, कि वो तो मेरे फेफड़े खराब कर देगी, उसकी मुझे आदत तो नहीं होगी. So this type of questions they have. Actually, the content of this medicine or the dose of that medicines which are inhaled is such a low as compared to the oral medicines of the same formulation, that is very safe. Like मैं हमेशा कहते हैं कि आप खाने के बाद आंखों में ड्रॉप डालते हैं, मुंह से गोली नहीं लेते हो, या कान की कोई तकलीफ हो तो कान का ड्रॉप डालते हो. वैसे ही आपको फेफड़ों का प्रॉब्लम है, आप यदि ओढ़ने का पंप या वो रोटाहिलर लेते हो तो आपके फेफड़ों में ज्यादा डायरेक्टली जाता है वो, तो आपको ब्लड में जाता नहीं है, तो उसका कॉन्सेंट्रेशन काफी कम है. सो दैट things that is one very common problem which we focus or which we come across. So at that time we always give them some examples. हमारे सामने कुछ डेमो दिए हुए रहते हैं. So with this we try to educate them. Same related to thyroid which we have already talked. And another very important thing about fatty liver. Fatty liver के लिए it is one of the factor or it is one of the disease where the patient can remain without any medicine and his fatty liver can be regressed totally with only lifestyle. It is one of the chronic disease which has no medicine required if the patient does a good lifestyle. लेकिन वो fatty liver का report देखने के बाद फिर huge number of questions and unnecessary medicines, then unnecessary parallel pathies and everything goes on.
So I can only imagine कि आप रोज कितने सारे patients देखते होंगे, and it is not only just about reading the reports and giving them treatment. It is about understanding and counseling and so many such things that you must be going through. And this is something which would have become very common. I mean, especially after social media or AI and everything. So hats off to doctors. I would say.
Platform probably will give a better better information to the people,
Right. So
because this is unbiased.
right.
So people probably will accept it more openly.
Very
Because we are always afraid of even giving a total truth to the patient. Patient feels कि उनका कुछ biased opinion तो नहीं है ना, उनका कहना काम ही है, वो तो उनके इसके लिए करते, ऐसा है. लेकिन like it is out of all their and our both benefit that we always give, because their well-being is our benefit.
Absolutely. Absolutely.
So irrespective of how busy doctor is, we must ensure that the message is very loud and clear that these medicines are very safe.
Right.
We may not like thread them कि इससे बंद करने से ये होगा वो लेने से क्या फायदा होगा. हाँ, आपको कुछ प्रॉब्लम्स आ सकते हैं जरूर, लेकिन you can always share with us.
Right.
And
Yeah, manageable.
yes, it is most of the time manageable if it is taken care at the right time.
Right. So if you could correct just one health myth permanently among patients, which one would it be and why? It's a difficult question, I'm sure. But what that one thing you feel?
I always feel कि it should be a comprehensive health. So health card consists of all things. So it should be a good lifestyle, including diet, exercise, drugs, and doctor. So having a good follow-up with doctor, proper drugs, proper timing, proper schedule, then proper diet and exercise. Exercise includes everything. It includes aerobic, resistance exercise, good sleep, everything. So all 4 compartments are must. ये चतुर्सूत्री है health की. So if we have a subject or if we have a class or if we have a like 11th or 12th का exam where 4 subjects are compulsory to pass. If we score 100 marks in 2 subjects and if we are not passed in 2, still we are fail. So same applies here. So if patient is doing very well with exercise but not following with the doctors.
Right. So a holistic approach
Absolutely.
is the key takeaway from this.
Right.
Wow. So this conversation itself has been so enriching. for all our viewers. For me personally, I'm sure most of the common myths or questions around chronic diseases, I think you have cleared up and summarized it so well for all of us, that this entire. So usually at the end of the episode, we always ask that what will be that one takeaway. But I think here the whole conversation is a takeaway for all of us. Indeed, it has been very, very enriching for all of us. So as we are coming towards the end of this fantastic episode and very serious discussion on busting myths, this is first time in Azkka Virtue podcast. We are trying to bring in some fun element where we'll discover the doctor behind the white coat personally, honestly, and in a fun way. So I'll be asking you a few questions. You have to be answering it rapidly and with a lot of fire, as we call it the rapid fire round. So are you ready for it?
Absolutely.
Okay, here we go. What do you enjoy more, diagnosing cases or counseling patients?
Diagnosing cases.
Okay. What is your hobby you wish you had more time for?
Cricket.
Okay. I think that is every boy's dream. What is one thing you love most about being a doctor?
Ashirwad patient ke.
Absolutely. So true. What inspired you to become a doctor in the first place?
I have one Dr. Rajesh Deshpande is one neurologist. He is at Jupiter Hospital. So he is my inspiring figure.
Wow.
Huh.
Okay. What is something small that makes you very happy?
Spending time with family.
Absolutely. So, sir, today's discussion was not just medical, it was emotional, practical, and life saving for many viewers. Today, we learned something which is very powerful. So, thank you for not just treating diseases, but for educating minds, removing fear, and giving patients the confidence to trust science again. Conversations like this don't just change awareness, they change futures. And to everyone viewing this podcast, your health journey is not just about perfection, it is about awareness, timely action, and choosing facts over fears. So, until next time, this is Azkka Virtue podcast, where awareness meets action. So, thank you so much for giving your valuable time and addressing this very, very important topic for all of us.
Thank you. Thanks a lot.